Good morning. First of all, I would like to thank the invitation to be here today in this research meeting. My name is Clara Simães. I'm a psychologist and a lecturer in the University of Minho in Portugal, and also a member of the Adaptation, Performance and Human Development Research Group, which is coordinated by Professor Rui Gomes. The study I'm about to talk today is a brief research from a large investigation about occupational and family stress in nurses, and me and my colleagues aim to analyze in this study the role of effort-reward imbalance model as predictor of Portuguese nurses' stress responses and sexual health. Occupational stress in health professionals has become a pressing social, economic and health problem in many European countries, including Portugal, and has proven negative impact on individuals' health, family functioning and quality of health care. So, occupational stress can be defined as the interaction of work conditions with characteristics of the worker in such a way that job demands exceed the capacity of the worker to deal with them. Our work was based on the effort-reward imbalance model, which highlights the high efforts and the low rewards in the workplace as the main conditions that incite occupational stress in the workplace, which is a huge risk factor for workers' psychological and physical health. This model also highlights the role of overcommitment, defined as a set of attitudes, behaviors and emotions that reflect excessive striving in combination with a strong desire to be approved and esteemed. So, research points that occupational stress is related to work dissatisfaction and burnout in nursing profession, marital and life dissatisfaction, psychological distress, functional inhibition of body systems, namely the sexual system. So our work was also based on the women's sexual response model, which underlines the motivational factors that increases the response, the women's sexual response. So hospital nurses are one of the occupational health groups most affected by psychological distress. However, there's a limited knowledge about the effect of occupational stress on stress responses and sexual health in female nurses. In this study, we aim to analyze specifically the role of occupational stress variables in predicting nurses' stress responses, the role of occupational stress variables in predicting nurses' health, sexual health, and also the moderator effect of overcommitment in the relationship between occupational stress and nurses' stress responses, and also the moderator effect of overcommitment in the relationship between occupational stress and nurses' sexual health. The measures used in this study included a socio-demographic and professional questionnaire and the Portuguese versions of the General Health Questionnaire 12, the brief personal survey to analyze stress responses, the effort-reward imbalance to assess occupational stress variables, and the index of sexual desire and index of sexual satisfaction to assess sexual health indicators. In a small group, we also analyzed biological indicators of stress, that is, the salivary cortisol levels at the time of awakening, and two samples were collected in one only day as presented here. So the data were collected from 4 Portuguese central hospitals. Services and units from 10 different specialties were involved, and the response rate was 51%. Our sample was constituted by 310 female hospital-based nurses from the northern region of Portugal. The mean age is 33 years old and only 51% were married. In relation to work characteristics, the pie chart here in figure 1 shows that nearly 78% of the nurses worked in pediatrics, cardiology, emergency, general surgery, and in general medicine settings. In table 1, we can see the professional characteristics of the nurses, and the average number of years in the profession is 11, and these nurses worked in a mean of 8 hours per day and 37 hours per week. 48% had a precarious type of contract, and the majority of the nurses were distributed by level 1 and level 2 category. That means that in order to become a level 2 category nurse, you have to work at least for 6 years in the nursing profession and have a positive evaluation of your work. 78% did shift work and 29% had a second job. Regarding the overall prevalence of psychological distress, we can see that 75% of this sample presents clinical levels of distress, which is superior to that reported in the literature. We also found in the small sample that in relation to biological indicators, 73% of the sample presented a reactive stress response given by the cortisol awakening rise. Concerning question 1, we found that effort-reward imbalance variables are predictors of nurses' stress responses. The effort-reward imbalance and the ERI effort were the main predictors of nurses' stress responses, and higher effort and higher effort-reward imbalance at work are related to increased nurses' stress responses, namely with increased psychological distress and pressure overload. We also found that overcommitment produce independent effects on nurses' stress responses, and we can see that overcommitment is related to a greater physiological reactivity to stress given by the cortisol measure at the time of awakening and the total morning cortisol release. In relation to question 2, ERI variables also predict and produced independent effects on sexual health indicators. ERI imbalance ratio was the main predictor and was related to reduced sexual desire and increased sexual dissatisfaction. Overcommitment was also an important predictor of sexual desire and sexual dissatisfaction, and higher ERI overcommitment was related to less sexual desire and more sexual dissatisfaction. Concerning question 3, we found an interaction effect of overcommitment on the relationship between ERI effort and nurses' stress responses. Namely, we found a stronger association between effort distress in relation to pressure overload for nurses with high levels of overcommitment, as you can see here. We also found an interaction effect of overcommitment in the relationship effort-sexual health relation, and the relation effort-sexual desire is only significant for nurses highly committed. That means that only nurses that are highly committed to work present a relationship between effort and sexual desire, with less sexual desire being associated to more stress. So to conclude, these findings show a high incidence of psychological distress and high physiological reactivity to stress in comparison to other studies in nurses. The main assumptions of the RI model were supported in this Portuguese and female sample. Job effort-reward imbalance and overcommitment were predictors of nurses' stress responses. Effort and the RI imbalance predicted higher emotional stress responses, and overcommitment was associated with higher physiological stress, reactivity to stress in nurses. In relation to sexual health, work variables produced independent effects on sexual health indicators, although with less explained variance, constituting a novel finding. Work variables impact both sexual desire and sexual satisfaction, although there's many other factors that can explain this variance. Overcommitment moderation effects were limited but significant, indicating that an overinvestment in work may affect personal lives, such as sexual and marital adjustment. So these findings highlight the importance of development and implementation of occupational health programs, aiming to reduce work stress and making work demands more manageable in Portuguese nurses, and provide informal and formal support services for nurses that show signs of being clinically stressed, and improve nursing training to include a stress management component, which educates nurses on the impact of work stress on different life domains, such as sexual health. And that's all. And many thanks for your attention, and I'll be able to answer any questions, any doubts.